Hi, my name is Kevin. I was diagnosed with polycythemia vera in my 30s, and that really shaped my mindset. I knew I had a lot of years ahead of me, and I wanted to treat the disease aggressively from the beginning, not just wait until I was high risk and for something bad to potentially happen. So I really had to hunt around to find the right doctor for me, someone who believed in shared decision making, and someone who was willing to treat my low risk PV proactively with BESREMi. I've been on BESREMi for about 3 years now. Being on BESREMi has enabled me to reach complete hematological response and to stay there. To this day, I have never needed a phlebotomy. I'm free of any incidents like blood clots, something that might take my PV from low risk to high risk. I feel good. I have the energy to do the things I want to do. BESREMi is doing all the things I hoped it would. My doctor and I talked about what the common side effects were. She explained there was flexibility in the titration schedule and that she could personalize the approach or provide me with ways to manage. I didn't have any hesitation about the potential flu-like symptoms. I was really putting BESREMi in the context of cancer treatment, and in that context, those side effects seemed very manageable. We're talking about a medication that treats cancer at its source. My reaction to the first injection was by far the worst. After that, I started taking acetaminophen proactively. It was a simple step that made a big difference for managing those side effects. I also began injecting later in the day so I could sleep through any flu-like symptoms. It was helpful for me to find the best time for me and my schedule to give myself the injection. After the first few months, those side effects pretty much stopped as my body became accustomed to the dose. I never considered not sticking with BESREMi. PV is something that I'll live with forever, so if there's an opportunity to treat the disease itself for long-term benefits, it's worth it in the long run. If you're new to BESREMi and are experiencing flu-like symptoms, talk to your doctor or pharmacist. They're there to help. And many specialty pharmacies have full care teams you can lean on. It's not something you have to manage alone. With shared decision-making and proper support, most patients can manage the side effects well and benefit from early intervention. It's important to know that when you start BESREMi, you might not see results right away. But most people will experience comprehensive results about 7 months or so after starting BESREMi. And for some people, like me, partial or comprehensive disease control can happen sooner. For me, after the first 8 weeks on BESREMi, all of my blood counts, red blood cells, white blood cells, platelets, and hematocrit were in range and have stayed in range since. Just because you may need phlebotomy early on doesn't mean the treatment isn't working. It just hasn't reached full effect yet. It's working in the immune system and treating disease at the source. Advice I share with people with PV, especially people who are younger, is that you have to look at the long game. Even if your yearly risk of progression seems low, it increases over time. Choosing a treatment that you can stay on safely for the long haul, something that addresses the root cause, not just the symptoms. You don't need to watch and wait until you have a blood clot, until your cancer progresses. There are things you can do proactively to stay ahead of and control your disease. Starting BESREMi when I did helped me to proactively treat the disease and gave me peace of mind for the future. I want to preserve my health not just for myself, but for my family, and BESREMi helps me stay in control of my disease.
Read this important safety information carefully. It explains the serious risks of BESREMi and how to take it safely. Talk to your healthcare provider if you have any questions. What is the most important information I should know about BESREMi? BESREMi can cause serious side effects, including conditions that may cause death or may worsen certain serious diseases you may already have. If symptoms get worse or become severe and continue, your healthcare provider may tell you to stop taking BESREMi permanently. These symptoms may go away in some people after they stop taking BESREMi. Mental health problems, including suicide. BESREMi may cause mood or behavior problems that can get worse during treatment or after your last dose, including irritability, getting upset easily, restlessness and agitation, confusion, depression, feeling low, hopeless, or bad about yourself, unusually grand ideas, acting aggressive or impulsively, thoughts of hurting yourself or others, or thoughts of suicide. If you develop any of these symptoms, call your healthcare provider immediately. New or worsening autoimmune problems. BESREMi may cause your immune system to attack healthy cells, leading to conditions such as thyroid disease, increased blood sugar, hyperglycemia, or type 1 diabetes. Call your healthcare provider if you experience extreme tiredness, frequent urination, excessive thirst. Heart problems. BESREMi may cause heart problems including cardiomyopathy, heart muscle disease, heart attack, irregular heartbeat, atrial fibrillation, decreased blood flow to the heart. You should not take BESREMi if you have uncontrolled high blood pressure, congestive heart failure, a serious abnormal heart rhythm, narrowing of the arteries to your heart, certain types of chest pain, angina, a recent stroke or heart attack. Who should not take BESREMi? Do not take BESREMi if you have or had severe mental health problems, especially depression, suicidal thoughts, or attempted suicide, have or had a serious or untreated autoimmune disease, are allergic to interferon or any ingredient in BESREMi. Symptoms may include itching, swelling, trouble breathing, dizziness, or chest pain, have certain types of liver disease, have had a transplant, and take immune-suppressing medication. Before using BESREMi, tell your healthcare provider about all of your medical conditions, including if you have any of the following: a mental illness, type 1 diabetes, heart or bleeding problems, problems with your immune system, hepatitis B or HIV infection, kidney or liver problems, are pregnant or planning to become pregnant. BESREMi may harm your unborn baby. Use effective birth control during treatment and for at least 8 weeks after your last dose. BESREMi may affect your menstrual cycle and could stop your periods. Do not breastfeed while taking BESREMi. What are the possible side effects of BESREMi? Serious side effects include low blood cell counts. Taking BESREMi can lead to infections, anemia, or bleeding problems. Call your healthcare provider right away if you develop weakness and tiredness, bruising easily, nosebleeds often, fever, chills, burning and painful urination, urinating often, or coughing up yellow or pink mucus, phlegm. Serious allergic reactions. Get medical help right away if you get any of the following symptoms: skin rash or hives, itching, swelling of the face, eyes, lips, tongue or throat, trouble breathing, chest pain, or feeling faint. Eye problems. BESREMi can cause severe eye problems with your retinas that can lead to vision loss or blindness. You should have an eye exam before and during treatment with BESREMi if you have diabetes or high blood pressure and also have retinal problems. Liver problems. BESREMi can cause increases in liver enzymes and liver damage. Your healthcare provider should do blood tests to monitor your liver enzymes and liver function before you start and during treatment with BESREMi. Kidney problems. Your healthcare provider will do blood tests to check your kidney function before starting and during treatment with BESREMi. Tell your healthcare provider right away if you develop any symptoms of a kidney problem, including changes in the amount or color of your urine, swelling in your ankles, blood in your urine, or loss of appetite. Tooth and gum problems. BESREMi can cause tooth loss and/or dry mouth. It is important for you to brush your teeth well, 2 times each day, and have regular dental examinations during treatment with BESREMi. Skin reactions. BESREMi may cause reactions such as rash, itching, and hair loss. Increased triglycerides. You may require blood tests to monitor levels. The most common side effects of BESREMi include flu-like symptoms, including tiredness, weakness, fever, chills, muscle aches and joint pain, itching, sore throat. These are not all of the possible side effects of BESREMi. Call your doctor for medical advice about side effects. You may report side effects to Pharma Essentia at 1-800-999-2449 or FDA at 1-800-FDA-1088. Please see full prescribing information, including boxed warning and medication guide, at BESREMi.com.